Prepare to be radicalized because this is outrageous. This study was eventually taken down, but it's hard to believe that this research was ever published in the first place. The study looked at women with a severe form of endometriosis, also known as rectovaginal endometriosis, but it focused only on their physical attractiveness, i.e. how attractive they were to men. Published in 2013, the study concluded that women with this form of endometriosis were more attractive than women in the control group, making claims about their body shape and even the age at which they first had sex. The fact that these women didn't even know that they were being rated on their appearance breaks so many ethical standards in research. And to make matters worse, the study involved evaluating physical traits like body mass index, breast size, waist to hip ratio, and other invasive things. Endometriosis is a chronic condition where tissue similar to the lining of the uterus grows outside of the uterus. It can cause extreme pain, inflammation, and sometimes even infertility. It affects 1 in 10 women and can take years to diagnose, with symptoms ranging from severe pelvic pain to digestive issues and painful intercourse. There is no clear connection for how attractiveness might impact the severity or progression of endometriosis. These women participated in this study hoping to contribute to research. They were suffering. They were already facing immense challenges of dealing with a chronic illness, and the study was defended for years by both the journal that published it and its authors, despite widespread criticism from doctors, researchers, and advocates for people with endometriosis. It wasn't until 2021 that the journal Fertility and Sterility finally agreed to retract the paper, but by then the story had already perpetuated these harmful stereotypes and undermined the serious, painful nature of this condition, as well as using up much needed funding for this condition. In fact, it was conducted at a time when funding for endometriosis research was already scarce, which means that it diverted attention and resources, critically needed resources, away from actually improving treatment options or finding a cure. We still don't know what causes endometriosis, how to diagnose it properly, or how to treat it effectively, and it takes an average of 9 years for a woman to get a diagnosis. In the meantime, millions of women are left suffering in pain, often without any real treatment options, and too frequently their pain is dismissed by doctors as not having any real cause. Women with endometriosis deserve better care, better treatment, a cure, and certainly not to be boiled down to their physical appearance. Let's hope that this study was a wake-up call for the scientific and medical community to shift its focus to what really matters and ensure that voices and needs of patients are actually met and at the forefront of future research into this chronic, debilitating condition. Because this isn't it.